Progesterone. Yes, it is the most important hormone of pregnancy. This supports pregnancy and helps to carry pregnancy. So, I am Dr. Sneha, fertility consultant and gynecologist. In this video, I will be discussing the importance of progesterone. So, what is progesterone? Where is it produced from? And how is it going to help pregnancy? To understand this, let's just go back to the basics of what happens during a menstrual cycle. During each cycle, there is release of this hormone called FSH and LH, which is produced by the pituitary gland. This comes and acts on the ovary, and this helps to produce eggs out of the ovary, that is to ovulate. Once the egg comes out of the ovary, then it is bound to its destiny. So when it is growing inside the ovary, the egg is surrounded by a few cells which produce estrogen. So this hormone goes and acts on the uterus, the lining of the uterus, and helps to make the lining thicker. And once the ovulation happens, how does ovulation happen? It happens again because of estrogen. When estrogen is maintained at a level of 200 picogram per ml for 50 hours, this acts at the level of pituitary and causes an LH surge. When this surge happens, there is release of the egg from the ovary. And once the egg is released, the remaining follicle forms the corpus luteum. After ovulation happens, there is release of progesterone from the corpus luteum in the ovary. This is stimulated by LH, which is produced by the pituitary. LH is produced in pulses. So this acts on the corpus luteum, which produces progesterone in pulses. So there's no cutoff of progesterone to say that this is abnormal or this is normal. When we measure progesterone in the luteal phase, which is the second half of the cycle, if it is between 3 to 40 nanogram per ml, this is when we say that ovulation has happened. So it could be as low as 3 or as high as 40. So the absolute value does not tell us anything about the ovulation as long as it is more than 3. However, if it is less than 3, this indicates that the progesterone is low and ovulation may not have happened. So this progesterone goes and acts on the estrogen primed endometrium to mature it, and it opens up the window of implantation. Yes, progesterone is required for implantation. So once the window is open, then only the embryo which is formed by the fertilization of egg by the sperm can stick to the uterus and develop. And also progesterone is involved in closing the implantation window. So there is a certain time for progesterone exposure in the uterus which will allow this implantation to happen. So this is about 3 to 7 days. If we give progesterone from the beginning of the cycle also, it is not advisable because the implantation window opens and closes much earlier, and it is not in phase with the development of the embryo. And if we give it later also, and if there's no internal progesterone, it may be a little difficult to get pregnant. So it is not only giving progesterone, but it is also important to time the progesterone and accordingly manage it. Sometimes what happens, if a pregnancy happens, then there is a shift of production of progesterone from the ovaries to the placenta. In the meanwhile, HCG hormone, which is produced by the implanting fetus or the implanting embryo, goes and stimulates the corpus luteum to produce progesterone. So if a pregnancy is happening and it's a healthy one, there is an increase in the progesterone along with the increase in beta HCG. However, if the pregnancy is an unhealthy one, then the progesterone may not increase because the beta HCG rise may not be proportional. So if progesterone is not very high and you're expecting a pregnancy, it usually indicates that it may not be a healthy pregnancy. And how do we supplement progesterone? It does not make sense to give progesterone throughout the cycle. I have seen a few women who read that, okay, they have a low progesterone in their blood. Somebody has measured it at some time of the menstrual cycle, and they tend to take progesterone throughout the menstrual cycle. It does not work that way. So it has to be taken after ovulation. If you can time your ovulation with different apps, your periods are regular and predictable, then you can time it on your own. Otherwise, it's better to visit a specialist who can guide you as to when you need to start progesterone and when you can expect your periods or when to do a pregnancy check. So what I normally do is once ovulation happens, once we document ovulation, we start progesterone after 2 to 3 days. If we started a little late also, it's okay, because there is some amount of progesterone which is coming from the ovulation which has happened in a natural cycle. However, there is different ways of giving progesterone in different cycles when we stimulate the egg or when we are doing IVF cycles. However, in a natural cycle, we usually start around 1 to 3 days after ovulation and continue it for about 2 weeks, after which we ask the women to do a pregnancy check. So progesterone is very important, and also the best way to give it is through the vaginal route. The absorption is better, and the place of where it should act in the uterus is very close to where we are delivering the drug. So this is more preferable compared to the oral option. And yes, we must take into account what the patient needs as well, what each woman needs as well, and accordingly titrate the dose and delivery of progesterone hormone.